I'm Dr. Naftali Serrano. Today we're going to talk about something that may be eluding you right now: sleep. Some people have problems with getting to sleep and others have problems with staying asleep or waking up too early. The common factor in both these types of people is that you're tired and don't feel rested. It is not an easy thing to deal with at all, and it tends to affect other areas of your life as well. Often you can develop other problems like depression, and other pre-existing problems are harder to deal with, such as chronic pain. Now, there are no perfect answers for solving all sleep problems, but I like to propose some basic ideas that may help you develop a strategy that works for you. Here's what we'll cover: basic rules for sleep, lifestyle factors that interrupt sleep, and medication options. There are two important factors in getting good sleep: what you do before you go to sleep, and what you do if you're having difficulty falling asleep. What you should plan to do is set a bedtime that you're consistent with, say 10 p.m. I know that might sound early to some, but in reality it wasn't until the invention of modern lighting that we started sleeping less and staying up late. In any case, the important thing is to be consistent about your sleep time because of your body's internal clock. The next thing you want to do is make sure you give yourself at least an hour of wind-down time before you go to sleep to prepare your body for the relaxed state it needs to be in order to sleep. In this wind-down time, you should avoid television or any other stimulating activity. The best thing is to have a routine that you follow, such as bathing, reading, washing dishes, or engaging in any type of repetitive activity. The idea is to give your body and mind time away from the normal activities of the day. You can't expect your body to immediately be ready for sleep if you've been rushing, thinking, and doing all day right up until that time when you want to sleep. Okay, so 1, set a bedtime that is consistent, and 2, give yourself an hour or more of wind-down time. The other thing to be mindful of is what you do when you cannot sleep or when you wake up too early. Here's the basic rule: do not stay in bed for too long a period of time. As you probably already know, the longer you stay in bed trying to fall asleep, the more frustrated you get. The more frustrated you get, the less relaxed your body is. The less relaxed your body is, the harder it is to fall asleep. So what you need to do is try not to stay in bed for more than 20 to 30 minutes at a time. If you haven't fallen asleep, or back asleep if you're awake in the middle of the night, then get up out of bed and leave your room for about 10 to 15 minutes. It's kind of like hitting the reset button on your body. When you get up, you can engage in the same wind-down type activities you do before going to bed. Again, no TV. In fact, you shouldn't have a TV in your bedroom. It's pretty bad for sleep. Then, when you're ready, you can return to bed and try again for another 20 to 30 minutes, being patient with your body and trying not to get too frustrated. You keep repeating this pattern until you train your body to be relaxed in bed and sleep. It's not easy to do. I've had to do it myself on occasion, but in the long run, it's a good approach. Now, often the way we live life is a cause of our sleep problems. There are certainly situations when medications you're taking and illnesses you may have interrupt sleep, but for the majority of people, it's how you live life. Here are some of the more common things that impact sleep. Being too busy. Busy minds and bodies forget how to relax, and as we have spoken, that leads to poor sleep. Second and third shift workers especially have a hard time with this. Stress. Life brings us difficult challenges in relationships, finances, work, and many other areas. When we begin to have a hard time coping with these challenges, our brains can work overtime, sometimes with worry, and at other times simply with the emotions that these things bring us. Overstimulating our bodies. One other factor that affects sleep are the things we put into our bodies. A poor diet, especially one that includes caffeine, such as in chocolate, soda, coffee, and tea. Too much alcohol, or drug abuse. These things directly impact the parts of the body that have to do with restful sleep. Understimulating our body. It is also true that not using your body well is a problem for sleep. When you don't move your body enough during the day, the body's wake time, it is as if you haven't used the body's stored energy for that day. Thus, it's harder to wind down at the end of the day. Long daytime naps also disrupt the body's internal clock. So the thing to do in each of these cases is to take stock of your life. It may be helpful to sit down and write out what you do and eat on a typical day to identify the factors that may be affecting your sleep at night. Achieving balance in life is difficult, but necessary for good sleep. Finally, there are medications that can help with sleep. Some are designed for short-term use, such as 1 to 2 weeks, while others are able to be taken over a much longer period of time. The short-term drugs, or what are called hypnotic medications, and other medications called benzodiazepines, these cause sedation immediately. These are potentially some you've seen on TV commercials. They're usually effective over the short term, but can also be addictive. These are best used for someone who does not have a long history of sleep problems and who may not need them every day or for a long period of time, although doctors have different prescribing patterns around this issue. They should be used with caution or avoided altogether with persons with a history of addictions. Drugs that can be used in the long term include some SSRIs, or antidepressants, or other antidepressants called tricyclic antidepressants. These include drugs such as trazodone and amitriptyline. The advantage of these medications is that they are safe to take over a long period of time, and that they may help with anxiety and depression at the same time. In either case, you and your doctor will choose the best medication for you based on the side effects of the medication and the type of sleep problem you have. In the long run, no medication solves sleep problems altogether. That is always a combination of changes you make in your life and sleep habits, aided by medications if necessary. Well, here's to restful sleep. Work it out between you and your doctor. For iPsyc.com, I'm Dr. Naftali Serrano.